With kids heading back to class, a new health warning for parents. Whooping cough cases are rising, and health officials say lower vaccination rates are making it worse. Candice Hare joins us live with more this morning on what families need to know. You certainly have my attention, Candice.
Good morning, Dave. So whooping cough or pertussis, it's a highly contagious bacterial infection, and health experts, they say that they are seeing more cases of it just as classrooms are set to start filling back up once again. Now, according to the CDC, they saw 6 times more cases last year than the year before in 2023, and experts point to a record number of kindergartners skipping their recommended vaccines last school year, potentially leaving more children at risk. Whooping cough can cause severe, repeated coughing spells and can be especially dangerous for babies and toddlers.
In very young children, as many as 2/3 will have periods where they stop breathing. About 20% of children who are young will get pneumonia.
Now, experts say that the vaccines for whooping cough, they've been given safely for decades. But one thing that's important to note is they said it takes 1 to 3 weeks for that vaccine to be effective. So if you're wanting to get your child immunized, don't wait till the day before school to get it done. Try to get that done now while you still have some time. But Dave, as you know, this is not the only illness that we see kind of flare up or have rises when the school year gets underway once again.